My name is Daniel Klotz, and I was speaking about the handling practices of human milk in the NICU. So we would love to feed human milk to our preterm infants because we think that's very beneficial to them for their short and long-term outcome in their future lives. So I think we miss out on the full effect of the human milk, which is beneficial for our preterm babies, if we subject this milk to procedures which are actually harmful to the milk itself, and may actually perhaps potentially harm our preterm infants. So I'm talking about basically pasteurization or freezing of milk, so we should aim to feed fresh milk to our preterm infants. I see that it's sometimes not possible because they need to be frozen, to be stored for a while, but then you really have to make sure that the procedures you have in place are really up to date, according to good practice, just to get the best result possible that you can have. There are many guidelines around to good clinical practice and many recommendations how you should treat milk for preterm infants. The problem is the evidence is not really there. So the guidelines are based on evidence of variable strength, and you don't really know if that's really good for your babies and the milk. So basically what people are doing is born out of tradition in their units, and they do what they always did. And it's really hard to apply knowledge into human milk treatment in that kind of setting. So the evidence we have is actually very conflicting, and that results that we have conflicting recommendations even within one country how to treat human milk for preterm infants. And it really makes it hard for practitioners to follow advice, and that leads to varying differences in how to treat human milk. What's happening is most likely some babies don't get the amount of milk we would like to have, and as I said before, so the full potential is not really, so we don't have the full potential for our preterm infants. So basically what we like to do is we like to standardize the procedure, standardize the practices which are being done in neonatal units throughout our country. And so we founded an initiative just to promote the use of human donor milk and of mother's own milk. And to do that, we are just about to formulate guidelines how to treat and how to handle this milk for those tiny babies. We try to really get all the available evidence together in one piece of paper so practitioners can have an informed choice about what they do with that milk or not. So we're actually driving this forward at the moment. There are no guidelines concerning mother's own milk within Germany, but this is really an issue which is true for many European countries. So most guidelines are looking at human donor milk, but not at mother's own milk.